Today I've come to answer plastic surgery in Gangnam to see my good friend Tony and get a consultation with Dr. Chaemin.
So I'm here with my good friend Jake Paines, and how can we help you?
Well, to paraphrase a friend who says that you don't walk around with a broken phone, so why would you walk around with a broken face?
I think your face is beautiful.
Aww,
It's true, he's a pretty boy.
Well, I'm here to find out how I could be prettier.
Alright, so what do you think you need to be prettier?
Smoking lines from when I was heavy smoking the day, and I know that's caused like a lot of, your crow's feet when you smile and lines on your mouth. Some small lines on the head as well, or big lines. That's why I have this hairstyle, so you can't see. Just signs of aging. I'm also curious about my nose.
Your nose?
Yeah.
You have a nice nose.
I know, it's a family nose, but I'm just wondering what I can do to change it.
What you have is a hump nose.
Yeah.
So you have a hump in your nose here. That's often genetics, or it comes from having a broken nose. Look to me again. And you have a bulbous tip nose. So it means that the tip of your nose is coming out bigger than it should. So your procedure would be very easy. The doctor would do an incision under here so you can't even see the scar. He would smooth out your hump. He would reduce and shape a little bit of your tip, and you would be done. So what the doctor can do is the doctor actually has a kind of Photoshop design program where he can show you the before and after photo before you do surgery. So you can design your nose with the doctor. That's the best way to do it because you actually know what you're going to get.
That's awesome. Okay, I'd like to get my face smoother. I have deep lines here when I smile. It's very noticeable like when I do a lot of television and video work, even performing. I use my mouth a lot. I'm very I use a lot of expression, so I want to kind of curb the creases in my face. When I come out on screen or in photographs when I'm performing, I always focus on these lines, treated lines on my face. So how do I get rid of these lines completely?
완전하게 없어지진 않겠지만 좀 더 개선을 하신다면 피부가 좀 처졌을 때 여기 약간 당겨서
Facelift? I need facelift. So I'm curious about my nose. I've heard that there's a means for me to be able to see if I can make any changes, so I've asked the doctor if it's possible for him to take a look right now. So what can you do to my nose?
For the design process, the doctor will need to take some photos and upload those photos to the computer program. He can show the patient the current state of the nose and then adjust the nose exactly how the patient wants. Here you can see him fixing the bridge and fixing the tip of the nose for Jake. Jake can also suggest to the doctor the kind of look he wants to have in the future. Once the design is done, the doctor can show him the before and after results.
I have quite a big nose, but it's a family nose. Everyone in my family has the same nose, so it's quite strange for me to even imagine. But now I look at it, he's made my nose look extremely cute. Yeah, does look nice. But now I don't look like someone in my family. I look better. I've done Botox a number of times. The procedure is slightly different. Bad experience is when I had cheap Botox, and it ruined my face for at least 4 months, and that was terrible because you go in thinking it's going to make your face better, you're going to come out with more confidence, and it did the opposite. I was doing a lot of filming and I didn't want to have my face be seen, let alone on film, on a camera. So yeah, that was the worst one. So I really recommend anybody, if you're going to get this type of procedure, don't go cheap. If you're gonna get cheap, you're gonna get what you pay for. So get someone that you can trust and get something where it's gonna be a good procedure. What I learned, and it's the first time that I've seen using those photographs, the before and after, post Photoshop on my face, learned that my nose could actually look. I didn't even think that my nose. You can give your face a completely different shape just by making these small changes. So I've learned that maybe that's something to look into doing in the future. I also learned that maybe I need a facelift, come a few more years.
A numbing cream is applied to the sensitive areas around Jake's eyes. The doctor then cleans the forehead and preps it for Botox. The Botox is injected into the forehead and it does not hurt, but it does pinch a little bit. After the Botox in the forehead is done, the lines and wrinkles around the eyes of Jake are also injected with Botox to smoothen them out. Filler is then injected under the eye area. This will fill the area and give him a much younger look. It is not painful at all.
Oh, you don't feel the stone.
The filler used is dissolvable and will last about 6 months. After the filler in his eyes is done, he gets the lines around his mouth injected, and with that his procedure is now complete.
Jake's done his treatment. His skin is very light and thus it can bruise very easily or be red, but his redness on his face should go away by tomorrow, and then the bruising over here under the eye, which can happen sometimes, will go away in a couple of days.
My recommendation would be, would you class this as plastic surgery?
Often they call it petite plastic surgery.
Petite plastic surgery, sticking a little bit of French, make it look
A little bit of French, make it look prettier.
give it that level.
But basically these are like cosmetic procedures that don't involve surgery itself.
I would say, I would definitely recommend before getting major surgery to try and get this type of surgery first, because in a matter of minutes, the way that he was like rolling in the filler, it did take some skill, sticking in the filler and rolling it, smoothing it out. But within a few minutes, with the mirror, you can see like, I can't believe like the difference in the faces. So I definitely recommend it. Surprised at like how much the fillers already make differences.
Yeah, I can see a big difference. The filler over here filled out your lines. Over here and over here, it filled out your lines as well. And your forehead already looks much smoother. Some last minute information for everybody. The Botox and the filler should last about 6 to 8 months depending, sometimes 9 months, minimum 6 months. If you get cheap Botox, if you get some kind of sale, you're often not getting the right stuff and you're often getting not the right amount, which means that you'll have to keep coming back. If you get it done the right way, you don't need a touch-up for Botox. So you do Botox, 6 months later it should still be there. Filler is a little different. Filler, 2 months later, you come up for a touch-up again, but the touch-up is free. It should be included in the price. Good.
Awesome. Happy. Thank you so much.
No problem.
Botox and fillers are relatively fast procedures and only take about 10 minutes each. If you would like to have an online consultation, please send us an email or a Facebook message at the information below. And if you liked our content, please like and share our video. Thank you for watching.